2 years ago, the World Health Organization made this announcement.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
At that point, the virus had not even been given the name COVID-19. The epicenter of the crisis then was Wuhan, China. A massive lockdown stopped the spread, and emergency hospitals were built in a matter of days. In a few weeks, the worst was over in Wuhan, and China would maintain low levels of infection throughout the crisis. When the WHO announcement was made, the U.S. had only a handful of confirmed cases. A few days later, then President Donald Trump declared there was little to be worried about.
A lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape.
But that was not the case. COVID-19 tore through the United States and many other countries with devastating results. Some countries like China, Australia, and New Zealand have escaped the worst, relying on quarantines, masking, vaccines, contact tracing, and testing. The US, UK, Brazil, and Europe have struggled to cope with multiple waves of COVID-19 as leaders try to balance public health measures with economic recovery and political pressure. Vaccines were not the quick fix many had hoped for. Early on, availability was limited and logistical hurdles proved daunting. And even as vaccines became widely available in the US, UK, and Europe, there were protest movements, with some firmly against the jab. Meantime, poor countries struggled to obtain even a small number of vaccine doses. The Delta variant sparked further waves of infection.
The Delta variant is well on its way to becoming the dominant variant globally because of its significantly increased transmissibility.
As 2021 was winding down, yet another new threat emerged.
So today we are announcing B11529 as a variant of concern named Omicron,
bringing more infections, hospitalizations, and deaths. 2 years later, progress has been made, and there are reasons to be hopeful, but the COVID-19 pandemic is far from over.
It's true that we will be living with COVID for the foreseeable future. Learning to live with COVID cannot mean that we give this virus a free ride. There are no easy answers, but WHO continues to work nationally, regionally, and globally to provide the evidence, the strategies, the tools, and the technical and operational support countries need.
But for those tools to work, countries and individuals must use them for the good of the entire world. Jim Spellman, CGTN, Bethesda, Maryland.